Hi, this is Jessica Roberts, head to toe assessment for residency summer 2021. Here is my scan of my 4 walls. There's our patient. Final wall. Ground. Ground. Ground all around. Hi, I'm Jessica. I'm going to be doing your head to toe assessment today. Overall, we're looking at our skin, warm, dry, intact. I don't see any lesions, nevi, scars, bruising, anything like that. Head is normocephalic. Hair distribution receding. Our hair texture is smooth and soft. No indentations, no infestations. Can you tell me if you have any tenderness here?
No.
At our temporal arteries? No tenderness. Can you clench your jaw? And that is our cranial nerve 5 motor portion is intact. Now open and close your jaw. Okay, no crepitus or subluxation of our TMJ joint. We're going to palpate our lymph nodes. So we have preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. Okay, we're looking at overall our facial features, symmetrical. Can you smile for me and frown? Puff out your cheeks, pucker your lips, and raise your eyebrows. Good. Our facial nerve 7 is intact. Close your eyes for me. Point to where you feel this. And the sensory portion of cranial nerve 5 is also intact. You can open for me. We are going to test our hearing. Tell me what word I'm saying.
Monkey. Apple.
Very good. We're going to do our Weber test for lateralization. Tell me if you hear or feel this more so on one side than the other.
No.
No lateralization. That's good. I'm going to put this on our mastoid bone. Tell me when you no longer feel a vibration.
Yeah.
Can you still hear it?
Yes.
And other side.
Yeah.
Can you still hear it?
Yes.
So air conduction is greater than bone conduction. We're going to inspect our ears. Our external ear, we do have some cauliflower ear going on with some fluid underneath, but no masses or tenderness of our pinna or tragus. Going to look at our tympanic membrane. Pearly gray. I see our cone of light at 7 o'clock, and I can visualize our bony structures. No erythema of that external canal. And looking at our pinna, we do have, our ears are symmetrical. Pinna and tragus, no masses, lesions, or nevi on this side, no tenderness. Tympanic membrane, pearly gray, cone of light's at 5 o'clock. And I can see our bony structures there as well. I'm going to take a look at your eyes. With your glasses on, cover up one eye for me. And read this line for me.
EPTZO.
And cover up the other eye. And read this line backwards for me.
OZTPE.
Okay. 20/20 vision, that's our cranial nerve 2 optic is intact. Go ahead and take your glasses off for me. Our eyebrow pattern growth is normal. No crusting of our eyelashes, anything like that. Symmetrical, excuse me, thank you. Symmetrical palpebral fissures. Our sclera are white, no icterus. Look up for me. Our conjunctiva are pink, no exudates, excessive tearing, anything like that. Okay. So I want you to look at the wall for me and look at my pen. Okay, we have accommodation and keep following it, and convergence. Okay, keep your eyes on my pen and just follow it with your eyes and not your head. Extraocular muscles are intact. That's our cranial nerves 3, 4, and 6 are intact. We're going to check our pupillary response. Look straight ahead. We have direct and consensual pupillary response bilaterally. And we're going to look at our eye structures. Okay, just look straight ahead. We got a red reflex. And red reflex on that side as well. Okay, I want you to close your eyes and smell this and tell me what you smell.
Peppermint.
Very good, that is peppermint oil. So our cranial nerve 1 olfactory's intact. Our nose is midline. Can you sniff for me? We have patency, bilateral patency. We got a little occlusion on the left side. Lips are moist, no cracking, no fissuring. Can you open up for me? Stick out your tongue and say ah. Okay. Our tongue is midline with no fasciculations. That's our cranial nerve 12 is intact. And soft palate and uvula rise with phonation. That's 9 and 10 are intact. Buccal mucosa, soft palate, hard palate, pink, moist. Posterior pharynx, no cobblestoning, no exudates. Our tonsils are about a +2. Lift up your tongue for me. Salivary glands, no masses, no lesions at the floor of our mouth, and our dentition appears in good repair. We're going to look at our neck. Our trachea is midline. I'm going to palpate our thyroid. And no goiter, no masses, symmetrical. Okay. Going to palpate our carotid pulse. +2 and +2. We're looking at our skin of our neck. A few nevi, but nothing that looks suspicious. No redness or swelling. Listening to our carotid. No bruit. And no bruit. Okay. I want you to shrug your shoulders for me. And that's our cranial nerve 11 accessory is intact. Going to look at our range of motion of our neck. So flex, extend and hyperextend, lateral, rotate, and rotate. Very good. Okay, I'm going to have you turn around for me. We're going to look at our back, scoot back some. Okay, looking overall at our skin, we have some freckles, some nevi. Nothing that looks suspicious again. No cyanosis, no tripod positioning, no signs of respiratory distress. Take a breath for me. We have symmetrical chest expansion. Say 99.
99. 99.
Okay, I'm going to do some tactile fremitus. Symmetrical, it wasn't overly exaggerated. So we're going to percuss. Resonance heard throughout. Just take some breaths for me. Okay, vesicular breath sounds heard throughout. I want you to say 99.
99. 99. 99. 99.
Say E.
E. E. E. E.
Whisper 99. No bronchophony, egophony, or whisper pectoraliquy. You can turn them back around to the front for me, please. Again, we're looking at the skin of our chest. No nasal flaring, no retractions, no signs of respiratory distress. Take a breath for me. Okay, chest expansion is symmetrical, say 99.
99. 99.
And tactile fronitus is symmetrical as well. Just take some breaths for me. Okay, and vesicular breath sounds throughout. We're going to listen to our heart tones, okay? Aortic, pulmonic, Erb's point, tricuspid, mitral with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. I'm going to palpate our PMI, and we're going to auscultate for a full minute. And I'll auscultate S1 and S2, no murmurs, no extra heart sounds. And I do not appreciate any thrills, heaves, or lifts. Okay, I'm going to have you lay down. Pause at 45 degrees and look over to your right. No jugular vein distension. Okay, all the way back down. We're going to repeat this. Aortic, pulmonic, Erb's point, tricuspid, mitral with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. I am going to move to our abdomen. Contour is flat. I don't see any scars from surgeries, no lesions, pulsations. We have a few nevi. We're going to auscultate our abdominal aorta, no bruit, renal arteries, iliac, and femoral. No bruits. We're going to listen to our abdominal sounds. And we have normoactive bowel sounds throughout. I'm going to percuss. Tympany, 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 dullness. I'm going to palpate. Tell me if you feel any tenderness, okay? And I do not see any grimacing. I don't feel any masses. Any tenderness?
No.
I'm going to palpate our liver. Okay, no hepatomegaly. We're going to palpate for our spleen. And it is non-palpable, which is what we would expect. Okay, come back up for me. Going to just check for some CVA tenderness here. Tell me if that hurts.
No.
Tell me if that hurts.
No.
Okay. No CVA tenderness. Okay, we are going to inspect our skin and our joints of our upper extremities. So I'm looking at our finger joints. No nodules, no crepitus, no redness, no swelling. Wrist joints, no nodules, no crepitus, no redness, no swelling. Elbow joints, no nodules, no crepitus, no redness or swelling. And shoulders, no nodules, no masses. They are symmetrical. We're going to test our range of motion. So fingers, flex for me, extend and hyperextend, adduct, adduct, abduct, and thumb opposition. Okay. Wrist joints, range of motion, flex, extend and hyperextend, radial deviate, ulnar deviate, and rotate. Good. Our elbows, flex and hyperextend if you can. And our shoulders, we're going to abduct, adduct, flex and extend. Okay, we have good shoulder range of motion. Testing our strip, grip my hands, squeeze for me. 5 of 5 grip strength, pull up your arms against me and push down. Good 5 of 5 bicep strength and shoulder girdle push against me and pull back against me, and 5 of 5 on our shoulder strength. We're gonna look at our skin of our upper extremities, no edema. We're gonna palpate our radial pulses, and they are +2. Checking our capillary refill, less than 3 seconds, so that is great. Close your eyes and point to where you feel this. We are checking our upper extremity sensation. Gonna go ahead and feel, to make sure we have lower extremity sensation. Point to it, there we go, great. We're gonna test our vibratory sense with your eyes still closed. Point to where you feel the vibration, and here, okay. And our medial malleolus. Okay. Okay. Keeping your eyes closed, you're doing good. Open your hands. I'm going to put an object in each hand. Just tell me what it is.
Popsicle stick and a nickel.
Okay, very good. Stereognosis is intact. And I'm going to draw a letter in your palms. Just tell me what it is.
A. O.
Okay, graphesthesia is intact as well. Okay, you can open your eyes. We're going to check our deep tendon reflexes. So we have brachioradialis, bicep, tricep, patellar, Achilles. Here, scoot back a little bit. And Babinski, Achilles, patellar, brachioradialis, bicep, and tricep. Okay, we're going to do some rapid alternating movements, testing our cerebellar function. So I want you to alternate your hands and do some thumb opposition and touch your finger to your nose and to my finger, back to your nose to my finger, back to your nose to my finger. Great. We're going to look at our lower extremities. Okay, no swelling, no edema, capillary refill of our toes, less than 3 seconds, dorsalis pedis pulses, +2, posterior tibial pulses, +2. Okay, we're going to look at all of our joints. So toes, joints, no swelling, no redness, no crepitus. Ankle joints, symmetrical, no redness, swelling, crepitus, nodules. Knees, no swelling, they're symmetrical, no nodules, no crepitus. We're going to do our range of motion of our toes, so flex, extend, and hyperextend. So abduct and adduct, internal rotate our ankles, external rotate our ankles, flex our ankles, extend our ankles, and rotate our ankles. Good. So pull your feet up against me. We're testing our ankle strength and push down, ankle strength, and our knee strength, push against me and pull, and our hip strength, pull up against me and pull down against me. Okay, we have 5 of 5 on our strengths. There are our lower extremities. Go ahead and stand up for me. We are inspecting our hip joints for symmetry. Swelling, nodules, or crepitus are absent. We're going to do our hip range of motion. So we are going to abduct and adduct with each one. Okay, good. We're going to flex, internal and external rotate, and extend. Same thing, internal, external rotate, adduct, abduct, flex, and hyperextend. Good, and our knees, we're gonna flex and extend. Knee, flex, and extend. Great. Turn around for me, we're gonna inspect our spine. We have concave cervical spine, convex thoracic spine, concave lumbar spine. Go ahead and we're going to do some rotation. So rotate just at your hips, just your spine. Rotate, yeah. Good, and flex forward. And no lateral deviation, no scoliosis. Come back up and hyperextend. Good. And lateral rotate, just side to side. Okay. I want to check your gait, so walk a few steps ahead and turn around and come back. And it is in tandem, so stand with your feet together. Doing a Romberg test, close your eyes. Looking at our balance, which is good. Open them up for me. And hop on one foot and the other foot. Okay, we have good balance. Thank you.